Life changed for many during the pandemic. Some lost a job, some worked from home. Many felt their stress levels spiking.
That's for sure. And all this week in our Health Check 22 series, we are looking at some of this year's biggest impacts on our health. And tonight, we look at a rising issue with how some women are choosing to cope.
You have a glass of wine in the afternoon and then carried into the evening with friends, and it just became more accessible, easier, and something to do at times.
Joy Hoover admits it was easy to have a drink or two or three during the pandemic. Raising two small children and suddenly working from home, she found alcohol to be an easy stress reliever, but it wasn't a healthy one.
So at what moment did you realize, wait, this is an issue?
Yeah, I mean, really, alcohol just started affecting my anxiety a lot and it started affecting my body and my mental health.
Joy isn't an alcoholic, but she knew she needed to make a change, and she's not alone. In a report released just 6 months into the pandemic, the Journal of the American Medical Association found alcohol consumption jumped 17% among U.S. women.
We've seen a trend in just kind of in the lives of women who are dealing with a lot of stress. Alcohol use is a very easy and accessible way for us to kind of cope, and it's socially, condoned.
Michelle Doobie is Chief Clinical Officer at Landmark Recovery, providing substance abuse treatment for Las Vegas. She points out we're not necessarily experiencing a spike in alcoholism, but even the smallest increase can have significant repercussions.
When alcohol begins to impact our ability to do the things that were required of us, getting our kids to school, getting ourselves taken care of.
The Mayo Clinic reports women are increasingly affected by alcohol-associated liver disease and develop more severe disease with lower levels of alcohol than men. A major concern when you consider women are also less likely to seek treatment for alcohol-associated liver disease.
It's extremely important to always evaluate any behavior that we're having. Is this healthy?
The good news is help is available for anyone with questions.
There's a ton of professional help out there to help, and there's so many different levels of it. I think people think, well, I'm using alcohol, so I'm going to go into rehab. That's not all treatment. We have a wide continuum of care.
Landmark Recovery offers a helpline where recovery specialists are standing by 24 hours a day, 7 days a week.
If there's an affordability issue, there's options for that as well, and we can help, raise awareness about what options are available. It's a no judgment zone. That's what we do. We're just happy that you called and are making that step to change your life.
Taking that first step is key, and sometimes the hardest part. Anyone can feel the social pressure to hang out and have a drink.
If it doesn't make you feel good, if you are curious about what it feels like without alcohol, I would challenge you to try it. See how your body feels without it.
That's exactly what Joy did. She stopped drinking in January 2021 and says for now, it's what works best for her.
I realized, it's okay. If alcohol does not work for my body, I can still be exactly who I am, have fun with my friends, hang out with my mom, mom friends, go on dates with my husband, and now we just order off the mocktail menu.
See, the mocktail menu works for her. And Landmark Recovery has specialists standing by for anyone dealing with substance abuse or anyone with questions. Just call this number right here, 725-217-9910. And this story is part of our 13 Connects initiative, sponsored by Subaru of Las Vegas, America First Credit Union, and Landmark Recovery. And one of the points that Joy had mentioned when I was talking to her, she said, this is a town surrounded by a lot of alcohol, and they try to push that for sales.
So the temptation's always there.
Yeah, she said, you really have to check yourself.
Makes sense.
Yeah.
All right, thanks, Tricia. Good story.